Hello, good evening, ladies and gentlemen. Welcome to Triple N Media Talk Show. I am Dr. NIK NIKAM from Houston, Texas. Today, we are talking about Texas inpatient consultants and medical internship experience. My two great doctor friends, Dominic Shrestha and Dr. Opara, have been instrumental in setting up this great inpatient experience for the high school senior students during their final year. And I have to tell you, in the last 20 years of my practice, all I had was high school seniors from Clemens, from Kepner, and Dallas, who worked in my office, sometimes 3-4 people at the same time, and they got one of the best experiences in terms of trying to understand what goes on in a doctor's office or in a hospital, so they can make a better decision as to what they want to do with their medical careers that they are dreaming of. With that brief introduction, I would like to introduce Dr. Shrestha, who is one of the physicians of the Texas Inpatient Consultants, and he is going to share with you as what are the things the high school students can expect when they come to work in a medical office like Texas Inpatient Consultant. Dr. Shrestha, yours.
Dr. Nikam, thank you. And thank you everybody for coming on. Texas Inpatient Consultants, it's a company that has welcomed and always participated with students in the community for the last 18 years. We have had more than almost 1,200 students graduate in the last almost 18 years, sir. We have hosted these students. We have had a lot, every type of patient that comes through our clinic, different varieties, different diagnoses. They come from the hospital, post-hospitalization, but they also come in follow-up as a continuity of care. They rotate with the doctors, the nurse practitioners, our physician assistants. What the students do is actually they are almost semi-doctors and semi-mid-levels. They actually get to do hands-on stuff. They scribe, they review labs, they do EMR, they do meds, but everything is supervised. Everything is supervised, and this is all COVID-free. This is what they do, Doc.
I think that's fascinating. I think you sort of reflect what I used to do. These are high school students who came to my office for the first time. That was their first job in their life. I mean, real job, not about, flipping burgers and all this. And I let them do whatever I was doing, like doing EKGs, doing their blood pressures, heart rate checks, looking at their medications, looking at their diagnosis and connect the medicines and the diagnosis and see why the patient has come. So you've done an excellent job, training 1,200 people, taking from high school and putting them in a driver's seat as a medical professional. I think that's what all these small clinics bring to these students, which really I want to emphasize, and you have done a good job. And let's talk to Dr. Opara and have him share his experience with the high school students. Dr. Opara.
Dr. Nikam, thank you very much. So this is a fantastic program that we started many years ago. We get these students in their formative years when they have a lot of indecisiveness. What will they do in the future? Some of them wants to be medical doctors, nurses, engineers, IT technicians, computer scientists, not just medicine. We have had some of them that has come to us. They actually want to deviate outside of medicine, but they want to see what is the clinic experience all about. Maybe they might be able to change their mind. I'm going to tell you how we do our selection process. We start from those in high school, usually above the 9th grade. We don't restrict anybody. They apply through the normal process. They send an email of their CV as if they're applying for a job position. Pre-college, college students, graduates, and we have even had postgraduates, even those that want to excel in their doctorate degree. We've been able to also encourage foreign trained medical graduates to come in and have the availability and experience of what the American medical system is all about. That also helps them in their career, application for residency, how to apply to their errors, and then be able to get a spot in residency program. Like I said earlier, we help to mold these students, help to make them have that capacity and decisiveness to make decisions in their career. Dr. Shrestha and me, we are very passionate about this. And luckily enough, we just hired Amy. I'm sure you're going to hear from her. She's been a darling to this program. In fact, in the last 3 months that she's been with us, I will say there has been a lot of new introductions, lots of more experience, and even expanded the program further. Even when these students, when they come to us, in addition to the aspect of clinical medicine that they share with us, we also allow them to do presentations so that they can have that experience and culture on how to do presentations, how to talk to the public. We give them different topics to present to the group. So this is a very fantastic program. We want parents, guardians, counselors to avail themselves of this opportunity of sending these young, talented students to us. Dr. Nikam, thank you.
Thank you very much, Dr. Opara. You also stressed on some important aspects, which I also had experienced when I had, like, for 20 years, high school students during used to call it business co-op program at that time. And the unique thing about working in a small clinic setup like yours and mine is they get to do everything. Whereas if you go to a large institution, if they put you in one corner and say, flip these papers all day long, that's what they're going to learn. But in a situation like a clinic where they are walking in steps with the nurse manager, the nurse, and the physician, and look at through the computer records of patients, you learn the whole thing. And you said many people, when they come, they don't know what they want to do, but now they get the exposure of the entire medical field. And I think that's where the beauty of working in a small group or a small practice, which makes a huge difference because you're being trained as a whole person in the medical field. Wonderful. Let's move on to Amy, and she's going to tell us something about what to expect. Amy, you have to unmute your mic.
Can y'all hear me?
Yes, go ahead.
Oh,
yes.
Sorry, I don't know what happened. Sorry about that. So my name's Amy. I'm the PA working with Dr. Opara and Dr. Shrestha. And I work with the students, all of the students of all levels on the training on our EMR, or the electronic medical record. We feel this is really important because the documentation of patient visits and lab results and radiology results is something that you don't really get taught in any school, whether it's med school, PA school, nursing school. It's something you really have to learn on the job. So we feel it's really helpful to have the students learn these skills when they're younger, especially like Dr. Opara said, in their formative years prior to pursuing these true careers. So while they're in that school, they can focus on the medicine and what they're learning, and the documentation comes and follows. So I'm responsible for training them on all of that.
That's fascinating. Amy, I could say you're like the first grade teacher teaching the phonics of medical profession. Because electronic medical records are so exceedingly important, and maintaining accurate medical records is much more important than the work we do with the patients or what we do in the hospital. And learning how to log on to the electronic records, how to create a record, and how to maintain it, that's probably one of the greatest experiences they can get. And I do commend you on, having the patience to teach these. But one thing I have noticed is all these high school students who come, they are extremely computer savvy. After 2 weeks, Amy and Dominic and Opara, you wouldn't believe they were trying to teach me how to do things better on the computer.
That's our experience as well.
Yes. Okay, let's move on to Desha, right? Desha?
Desha, that's correct.
Desha, okay, Desha, let's hear. Hi, Desha.
My name's Deja. I'm one of the managers at TIC. And my primary responsibility within the student program is basically being an advocate to the students. So if they're having any challenges or problems or have questions, I'm there to guide them and make them feel supported within the program.
So what are their hours, for example, if they're working for the clinic?
It's typically 3 p.m. until 6 p.m.
Oh, I see. Yeah.
For the students.
Yeah. Now let's hear from Sandy.
I'm.
Go ahead, please.
Oh, I'm one of the managers as well for TIC, and I've noticed that with the students, when we give them any work to do, they're very efficient, they're fast, and they know what they're doing. And honestly, some of the computer skills is so much better than my skills. And I thinking that my skills are good, but their skills is so much better than mine. And they're able to actually teach me how to do certain things too in an efficient, faster way as well.
Yeah, you're absolutely right, because I used to read EKGs, 50, 70, 100 EKGs in a day. And I can't sit and enter 100 patients' demographics into a computer. It might take me a month. But these students could finish off that in a couple of days. You're right, they have excellent computer skills, which makes it easy for them to even grasp what we are trying to explain to them in terms of medical jargon. And that makes working condition much more pleasant because we are sort of tuned into the same frequency because we have to deal with electronic records and we don't have a choice. Dr. Dominic is laughing, but it is something we have to learn. And that's one thing the high school students bring, and that is they are very good at computers. Okay, let's move on to Kim and let's hear from Kim.
Hi. I'm
Hello.
actually a former student at TIC, and I'm in the process of interviewing for PA school. And I've gotten accepted to a few out-of-state schools, and I'm interviewing in-state. And I'd say the biggest takeaway from volunteering at TIC has definitely been being exposed to a lot of chronic diseases that I did not know much about, like diabetes, hypertension, and being able to, like the doctors and Amy said, interpret labs and look at the different medications and also preventative methods to treat those diseases has really been eye-opening and something that I plan to continue as a future PA in my community.
So did that in any way change your mind as what you wanted to do? Huh?
It definitely consolidated as to what I want to do, for sure.
So what was your expectations before you started? What were you dreaming to get from the experience?
At first I thought I was going in to do more like what you mentioned before, more like paperwork and less involvement with the patient. So when I realized how involved I was very kind of scared at first, but the more comfortable I got, the more I realized how beneficial it was for my future practice as a PA. So I'm definitely grateful for it.
Oh, that's great. No, I treated all my students like family members because my own kids went to Clemens. So I know who these people are. And if you treat them with respect and give them time to learn, make mistakes and all this, I mean, that's where you feel free to learn, knowing that even if you do something wrong, it's going to be, explained to you as how we can do it better next time. And that's one of the advantages in a clinic setup because we are on a one-on-one personal connection with the doctors, with the nurses and the office managers and all these things. So it's good to hear about your experience. And let's talk to
Nick,
yeah.
Before we go on, this is Dominic here.
Yes, go ahead.
And if we may interject myself, Opara, and maybe Amy, I would like to interject about Kim.
Yes.
So Kim has been with us for a little over a year. And I think we want to first of all wish Kim the very best. I think she'll get placed into a very good place, number one. So the best over there. But Kim has, I think, gotten such a wealth of information, wealth of confidence. She's what we call in TIC a triple eagle, She is flying at the 10-mile high altitude. Yeah, and she is in that rare air where not many people fly that high. I can tell you, you can just take any case and just tear it off, you know. Trust me, that's the confidence. I'm telling you, no question about it. So I think with that being said, I think where is the certificate and the gift? Daisha, you got a gift, and Ashley, you got a certificate. I don't know if we can pull.
That's great.
This is your gift card. I'll mail it to you.
Go.
Oh, wonderful.
Congratulations.
Thank you.
And Ashley, where is it? Where is Ashley?
Yeah, she's showing it here on this side. So.
Okay.
Thank
All
you.
right. That's wonderful. It's nice to hear, you know, people are getting good experience. I mean, the main purpose of doing this program is for students to get one of the most friendly, humbling experience of dealing with real sick patients. I mean, that's the bottom line, because, you know, we are here to help our patients. We are here to help our staff. We are here to help students also. So let's move on to Vance. We have Vance.
Yeah, Vance was there.
Hello, good evening. Go ahead,
Hear me?
sir.
Great. All right. My experience was I did a preceptorship with Dominic, Dr. Shrestha here, and so I kind of my experience of learning was so much hands-on and very broad-based knowledge, especially from Amy. Dr. Opara, I've known him for years, but besides Amy, but just being with them and getting the knowledge that base from them and being able to expand that knowledge, in which it was being in internal medicine, which is a completely different than going into a primary care setting to where I'm in right now, and so they gave me more knowledge as far as how to be able to handle certain situations, how to be able to treat. I even used the vibrating tuning fork for the feet now to check and monitor, and before we do ABIs on patients. So that was another thing that was extenuated, and so I appreciate them for the wealth of knowledge that they provided me.
That's wonderful. So where are you headed?
This is my last semester for nurse practitioner, and I'll be back in Austin. And then I'll be back in Houston too. So I'll be both places. So they'll be in one's going to be in a family practice clinic. The other one's going to be where I go to actually people's homes and actually treat them there at their house. So it kind of keeps them from coming out in the community getting COVID. So that was the other thing that we're changing.
Yeah, and if I may interject on Vance, congratulations on graduating at TIC.
Thank you, sir.
And Vance, also, we've known Vance for ages in his past life. I think Vance calls me Dominic, I call him Vance because he was administrator at one of our nursing homes for the last, I don't know, donkey's years, like 10 to 12 years, I would call it, right? But anyway, the bottom line is once you're going to be handling a lot of important lives, I guess real lives, you are going to be a blessed man. And yeah, you're going to be a flying 5-mile-high eagle, man. So go with all the knowledge and confidence. You're really got a lot of skills now and confidence. You're right, tuning fork. I think tuning fork and a lot of other things you've learned. But I think EMR, things that you learned, the 3, 12, 12, 12, 12, don't forget that, keep it up. I think we'll continue to keep in touch. One of the things about TIC is keeping in touch is very important,
Yes, sir.
And stay in touch with us in Houston. Okay. I think Vance has got something also. Where is his certificate and his gift, please?
Oh, thank you.
Who's got his gift and certificate? Yeah. Put it up.
Congratulations, Vance.
Thank you.
part. Thank you.
So if I may, Rochester?
Oh, yeah,
Dr. Nikam? Okay. So I just want to thank Vance, for the opportunity of coming back to see what we do on a daily basis. And we have known Vance for quite a long time, and he's been part of the family. Yes, and I'm sure by the time he graduates, he will still be coming back to check on us from time to time. That's one thing about this program. We don't help out the students and then they go their way. We still keep in touch with them. We like that continuity in the relationship. And Vance was so loving, very punctual, very hardworking, very committed. He loves his patients, and he took very good care of them. And then a few words on Kim. Kim has been with us for almost a year, if I'm not mistaken. Yes, I would say she's the longest serving student we have ever had. Me and Dr. Shrestha, we are so appreciative of what she has done for us. She's always helpful. I can't even remember if she has ever called in sick. Yes, and she is so punctual. In fact, each time I come in from the hospital to do my quick clinic, once I see Kim and Vance, I know that those days I have to leave early. That's how fast they are. Very good with IT, and their scribing was so helpful to the practice, and we really thank them. And we wish them well, wherever their career will take them.
Hi, so can you hear me, first of all?
Yes.
Okay, so currently I'm actually an undergrad at Baylor University. I'm a freshman now. So, and my major is health science studies in the pre-med track. So I'm excited to be here. And one key takeaway I had from TIC is just getting the experience of working with health professionals like you guys and all the doctors, and just doing shadowing a bit, seeing patients and communicating with others has been a great joy. And I really enjoyed this experience, and I want to thank you so much.
Arjun, I think congratulations, by the way.
Thank you so much. Thank you.
How is it there in pre-med, by the way?
Good. It's very good. It's been actually a very big major here at Baylor. Like, it's one of the most competitive majors of all freshmen, and I'm just very happy to connect with other students and be here and just work with them. So it's very nice overall.
I see. Is anything at TIC making sense over there?
Yeah, some of it is. I'm learning key concepts of what to do in a professional setting, in a healthcare setting, and just the general basis of when to see patients, and using all the knowledge you guys showed me there. I'll apply it here and it'll be very big. So
good. Yeah, give us some feedback. But
yes, I will.
Absolutely. Let us know. I think we've got, a gift and a certificate for you, ladies.
Thank you. Thank you so much.
You're welcome. Congratulations.
Thank you.
Okay. Thank you. Welcome. And congratulations, all three of you all, for graduating. I think we can go on to the next, what is the next thing here? We have, I believe, is it Dr. Suleiman, right? Dr. Suleiman?
Hello, can you hear me?
Yes.
Yeah, I'm Dr. Suleiman. I'm a foreign medical graduate, and I'm actually doing my United States clinical experience internship at TIC, and I'm also going through my electronic residency application system as we speak, which is the ERAS. So for IMGs, it's very important for you to have clinical experience, more so having a program that can support you as you're doing your applications to different hospitals with respect to your residency. And that's what TIC represents for me. And I'm super grateful for being here, for all of the hands-on experience and, all the opportunities that I get to live through on a daily basis.
That's fascinating. Tell us, how is medicine different here in the United States compared to where you completed your training?
Right. So I completed my training in Nigeria.
Yes.
In the US, there's a whole lot more control in the patient's hands as opposed to where I'm from.
Mhm.
So in the US, you have to be mindful of how you interact with the patient. You have to be knowledgeable because most patients could have questions, and you have to be able to, address their fears, address their concerns, and also make sure that you're giving them a well-rounded care. Not just in respect to what they've come with, but just in general overall. So you're a good clinician. And that I picked up from TIC.
So they treat you to be a more human doctor.
Correct.
As opposed to a technology doctor.
Yes.
Okay, we'll move on to Nyla. Let's hear from Nyla.
Hi, I'm Nyla Jackson, and I'm a
Hello.
senior in high school.
Mhm.
I'm also a student intern right now going through my session with TIC. I hope to go to college to become a psychiatrist. And I hope that TIC will teach me a more hands-on experience with patients, with communicating with a team, and to give me more confidence in becoming a medical professional.
One of the most important things as a psychiatrist, what you need to learn is listening. 80% listening and 10% nodding head. I mean, that's one of the things as doctors we need to learn. I say that because most of us as doctors, we don't listen. That's why patients get mad. They say the doctor was not even paying attention. You ask anybody, they say the doctor was not paying attention. That's why what I used to do is when every time I went to the room, I just had a notepad, not this iPad or something looking through the computer. I just looked at the patient's face and said, tell me what you want to tell me. So that's the most important thing we need to do when we are talking to the patient is have nothing between the patient and us. And our entire focus needs to be on the patient's presentation. Okay, that's wonderful. Ankita is next. Is Ankita here? Hello.
Hi, I'm Ankita, and I'm also a senior in high school, and I just
What high
recently
school do you go
joined.
to?
I go to Austin High School.
Okay, wonderful.
And, and so I just recently started the student internship at TIC, and so far I've had like an amazing experience. I learned how to like audit charts, and I was able to see the different all the different people in the clinic do their everyday task, and that's something that I wanted to gain from this experience and like see like what like different medical professionals do in like firsthand experience, because that's not something you can get from just researching. So that's something I hope to gain from this experience.
Absolutely right. What you're getting here at Texas Inpatient Consultants is a hands-on experience. No textbook can teach you what you learn here from so many people in the clinic, 2 doctors, administrator, clinic manager, all these people, and interacting with patients. So there's nothing that can replace a hands-on experience. And that's where I think I will focus every minute. And we all need to do some homework. When you go back, if you don't understand something, write down the words, do some Google search and find a definition and find out, what it means. Or if you have any questions, you can always ask the staff and, they will be more than happy to explain. The more we understand, it makes it easier to move further and further in getting a better knowledge of the medical field. Okay, let's move on to Ashley.
Hi, I'm
Hello,
Ashley.
How are you?
I'm good. How are you?
Good.
I'm a junior in high school currently, and I want to go into pediatrics. So I recently started this internship at TIC, and I really love the environment here, and I love how much I'm able to learn, even though I just started. And I'm really looking forward to learn more aspects of the medical field.
What high school do you go to?
I go to Elkins High School.
Which one? Elkins?
Elkins, yeah.
Okay. What got you interested in pediatrics?
Well, I've always been interested in the medical field in general, and also I like working with kids. So
Well, when you're working with kids, here's a tip I would like to give you. You need to listen to every word the mother is saying or asking.
Yes.
It's because the mother knows what's happening with the kid. The kid may not be able to explain what's going on. So we have to pay attention to the mother as much as possible to get the idea. And also, if the mother is not happy, the kid is not going to be happy. All right, let's move on to Kofo. We got a couple of more people. Yes, Kofo.
Hello.
Hey, good evening.
My name is Kofo. I'm a freshman at the University of Houston Downtown, majoring in nursing. And I started the internship program at TIC, and so far I've been able to learn from different people and being able to get hands-on experience, and I'm looking forward to gaining more experience and being able to use that in my future career.
So what is your background?
I'm a background. What do you mean by background?
You in school?
Yes, I'm majoring in nursing.
Oh, where?
Nursing at the University of Houston Downtown.
Oh, University of Houston. Oh, that's wonderful. So you have all the way from a full-fledged nurse practitioner to rookie students, even junior students. So you have a wide variety of students, and that's what inpatient consultant brings, vast experience that can span an entire spectrum of age groups and different interests. That's fascinating. Okay, do we have any guests or parents here today? Or if not, I think I want to.
Yes, I am. I'm a guest.
Oh yes, please. Could we have your name and let's hear you?
My name is Raj Gopal Vaklavarnam. I met you before, but I'm just trying to understand what is this, and I'm looking for my son who is in Hightower High School Medical Academy, which he basically is looking for some experience with clinicals.
I see, yes.
And I just wanted to know more about it.
Okay, the best thing would be to call Dr. Texas Inpatient Consultant's number and talk to the manager, and then they can walk you through as what is the process, and they will maybe set up an interview, and once the interview is over and you go over what all the things that are done that we have talked about today, and then we just go from there. What school does your son go to?
Let me, Dr. Nikam, let me answer Mr. Raj a little bit here. Hightower, I think Science Academy is a pretty savvy place for, I think, a lot of medical, pro-medical students. I think a lot of doctors, future doctors are going to come from there.
Yes.
Yeah, we'd be definitely interested in knowing about, is this your son, Mr. Raj?
Yes, it's from, my son is in junior. He's going into, now he's started junior.
Okay.
So he wanted to, he's in medical academy.
Okay.
He wanted to know a little bit more on, the clinical side.
Got you. So if you don't mind, you can go to our website. If you just look at the link that we had, Dr. Nikam's, the advertisement that we had for this show. And if you look at our TIC webpage, there is the main number, call back, and then ask for the manager by the name of Desha. She's on this. You can see her there. Okay. And please send in your son's resume to Desha. Okay. What is your son's son's name, sir?
His name is Bilwanilai. Bill. He'll go by Bill. But his name is Bilwanilai Vakulabaranam.
No problem.
I tell you, if he's got a deal, he's going to succeed no matter what.
It's true.
Anybody else has any questions? It's like in English, they say, if you have the heart, you can make it. We have somebody else?
Yeah.
Go ahead. Go ahead, please.
So I have a question. I'm a parent of a 9th grader.
Could you introduce yourself, please? So we'll
My name is Anjan Kumar.
Okay, wonderful. Go ahead.
Yeah. So my daughter, she's going to 9th grade. So just I have the same questions like the previous caller actually talked about. So what is the procedure to go and to your TIC to get some experience, like volunteer experience or something like that?
Let me answer that. So I think, is she getting into the 9th grade, you said?
No, she's in 9th grade now.
Gotcha. Yeah. So Mr. Kumar, I think it's the same process as the other gentleman.
Right.
I think if you want to go to our webpage,
right,
and look, I'll give you a telephone number. If you gentlemen have a pen and paper.
Yeah, I have a pen and paper. Yeah.
It's 281 265 0409.
Okay, gotcha. Yeah.
And that would be one way.
Yeah.
Otherwise, you can also write this email.
Yeah.
Manager to at TIC dash Texas, full Texas, okay?
Yeah.
.com.
Okay, got it. Yeah.
Manager to at TIC dash Texas.com. That will go straight to our manager on this call, on this conference, Desha. Okay.
So manager two is a number, right?
2 number. Yes, sir.
Okay, got it. Yeah. Thank
you. Okay, wonderful. Anybody else has any questions?
Yes, if I might chip in something for Mr.
Sir.
Kumar, Kumar and Mr. Raj. Are you still there?
Yeah, I'm still here. Yeah.
So Mr. Raj and Mr. Kumar, so basically what this is all about is, those our young sons, daughters, during their formative years, above the 9th grade, 10th grade, pre-college, and those that are in college.
Okay.
So some of them are indecisive. They don't know really what they want.
Oh, yeah.
Some of them, they want to have a feel. What is it like to be a doctor? What is it like to work with a doctor? What is it like to work as a nurse? What is it like to work in a clinic setting?
Right.
So this gives them that opportunity to relate with people in the medical field. And when they come in, they get on-hand experience. They work directly with us.
Yeah.
Both the clinical aspect and the administrative aspect.
Oh, okay.
So that gives them enough avenue
to
be able to make decisions in their life. That yes, I can now say I want to be a doctor. I like what they do. I like to work in a setting like this. And it also gives them opportunity to advise their colleagues that don't have this type of opportunity. Yes. So that's typically, in summary, what we do.
Okay, gotcha. So
okay, that's wonderful. Ladies and gentlemen, I am Dr. NIK NIKAM. This is a NNN talk show. We have been talking about the Texas inpatient consultants medical internship experience and how to enroll yourself in the future. If you have any questions, you can send us an email or go on website and look for Texas inpatient consultants, and you can call the clinic. Excuse me, you can call the clinic and they will be happy to walk you through as what needs to be done. And ladies and gentlemen, this is being live streamed to YouTube also and to our Facebook. Please subscribe to our YouTube channel and we will see you next time. Thank you, Dr. Dominic Shrestha, Dr. Opara, and all the ladies and gentlemen who have taken part in this presentation today. Thank you so much.
Thank you, Dr. Nikam.
Dr. Nikam, thank you. And thank you, everyone.
Thank you.
Thank you.